Hi, I'm Allie Bowden, and this is my N251 head-to-toe health assessment. Hello.
Hi.
How are you doing?
Good. How are you?
I'm doing pretty good. My name is Allie Bowden, and I'm just going to be doing a full head-to-toe assessment on you today. Exactly what it sounds like. I'm going to start at your head, go down to your toes, just making sure everything's healthy for you, okay?
Okay.
Alright, so I'm going to start out just with a couple of questions to make sure you're AML times 3.
Okay.
So can I ask what your name and your date of birth is?
Lindsay Simi, April 6, 2002.
Okay, perfect. And what state are we in?
Michigan.
Alright, and what year is it?
2022.
Perfect. Alright, I'm going to get started with some health history questions.
Okay.
So do you have any past family history that you're concerned about?
Not that I know of.
Okay. Any current diagnoses of your own?
Nope.
Alright, and then are you on any medications?
No.
No over-the-counters, herbals, vitamins?
Nope.
Perfect. Any surgeries that you've had?
Yeah, I had my tonsils taken out when I was really young.
Okay.
And then I had 2 surgeries on my arm.
Okay. So you got some nice scars there. Those healed up quite nice. Has it given you any problems since then?
No.
Alright, sounds good. Alright. And then do you smoke?
Nope.
Alright, and then do you drink alcohol?
Nope.
Okay. Do you partake in any street drug use or recreational drug use?
Nope.
Okay. And then just a couple of lifestyle type questions. If you could just run me through just a quick day-to-day diet that you've got.
In the morning, I normally just have like a bagel and my coffee, whatever. And then for like lunch, I like salads or wraps. And then dinner, it's like chicken or rice or whatever.
Perfect. All right. And then, are you physically active?
Yeah, I try and exercise when I can.
All right. About how? A few times a week?
Yeah.
Yeah. About how long do you?
Probably
say?
an hour.
All right. Sounds good. So you're fairly active. You got a good diet. Perfect. And then I'm just gonna ask you, are you in any pain today?
Nope.
Okay. Perfect. Okay. I'm gonna go ahead and get a set of vitals on you.
Okay.
So I'm gonna start out by just taking a peek at your hands. I'm just looking for any clubbing, which is just like poor oxygenation to the fingers. I don't see any. You don't smoke. You don't have any respiratory illnesses or diagnoses or anything, so I wouldn't expect it in you.
Okay.
Here I would also put on the SpO2 meter, and for you I would expect yours to be between 96 to 100, probably closer to 100 since again you don't smoke, no respiratory issues, and then I would also take your temperature. So average is about 98.6, is that what yours typically runs?
Yeah.
Okay, perfect. And then next I'm just going to take your pulse. Okay, so come down here. I got your pulse to be about 80. Is that normal for you?
Yeah.
All right. And then while I was down there, I also did take a peek at your respiration rate, and I got about 16. So that's also within the normal range. We want your heart rate to be about 60 to 100, and then your respiration's about 12 to 20. So both looked good. So next I'm going to just take a quick blood pressure on you. Do you prefer which arm I'm on?
It doesn't matter.
Okay. So come on this side.
That's okay.
Getting your blood pressure about 118 over 76. Is that about normal for you? Perfect. All right. Right, we are going to go ahead and get started with our assessment. So first what I'm going to do is I'm just going to take a look at your hands again. I'm going to check cap refill here, and I want it to be less than 3 seconds, which it is on both hands. I already noted any clubbing and I didn't see any, so I'm going to go ahead and flip your hands over. Just going along. I'm checking muscle tone, symmetry, skin texture. I just want to see if there's any like abnormal spots on you. I'm not seeing anything that would raise any concern for me. Your muscle tone feels good. The next thing I'm going to do is I'm just going to palpate both of your radial pulses. Just make sure they're nice and symmetrical, which they are. I'm going to rate those about a 2. And then I'm going to come up to your brachial pulse. And I'm also going to rate those symmetrical at a 2. All right. Next thing we're going to do is we're going to do some like range of motion type stuff. Okay. So I'm going to have you, just like you're swimming, kind of go like this. I'm going to put my hand on your shoulder, and I'm checking for crepitus, which is just like cracking. Maybe like a little, just a tad of like grinding back here. Does that cause you any pain or discomfort?
Nope.
On this other arm. Okay. And back. Perfect. Okay, so I'm going to have you go like this with your wrists, and then just like you're lifting some weights. Perfect. And then we're going to do the same thing on your feet, so go ahead and twist your ankles for me. Wiggle your toes a little bit. And then I'm going to have you kind of extend your knee up. Okay, some cracking in there. Did you play sports?
I did.
Yeah? What did you do?
I did like tumbling competitive cheer.
Okay, so that'll do it. Does it cause you any pain or discomfort at all?
My physician knows about it.
Okay, perfect. Awesome. All right, next we're going to do some like strength type stuff. Okay. So I'm going to put my hands here. Go ahead and put your hands on mine and push down. Good. And push up. Good. And then go like this. And you're going to push in. Good. And then push out. Same thing on your feet. You're going to push out for me. And push in. And then push up for me. And go down. Good. Awesome. I'm going to test some cerebellar function for you too real quick. Okay. Go ahead and put your hands on your lap right here, and then flip them over, and then go as fast as you can. Awesome. Go ahead and make an okay sign for me, and then go to each finger, and then go as fast as you can. Good. Good. Cerebellar function looks great. Okay. So the next thing I'm going to do, I'm going to assess your spinal accessory cranial nerve number 11. So I'm going to put my hands on your shoulder, and I'm going to have you raise your shoulders for me. Good. Perfect. Spinal accessory nerve is intact and looks good. Next thing I'm going to have you do, is it okay if I ask you to take your hair down for me? I'm going to move on to your head.
Okay.
So, do you dye your hair at all?
I don't.
All right. Your hair's very pretty.
Thank you.
So I'm just looking. I want to see if I see any like abnormalities like dryness or rashes or burns or anything. I'm not seeing anything. I'm going to take a peek behind the ears. Sometimes we've got like little moles and stuff behind there that we don't really see. And I do see you got all sorts of cute piercings.
Thank you.
They're very pretty.
Thanks.
Yeah. Cause you any problems at all?
No, I've had them a while.
Oh, perfect. Awesome. All right, while I'm back here, I'm just going to feel your occipital lymph node. Next, I'm going to do your post-auricular. And then here, your pre-auricular. I'm going to go down under your chin, and we're going to do the submandibular. Can't speak. And then your submental. I'm going to go down your cervical chain, right on the sides of your neck here. And then I'm just going to pull this down just a tad. Okay. I'm going to have you raise your shoulders up so I can see those collarbones. Go into the supraclavicular. And I'm also going to check skin turgor while I'm down here. And I'm not seeing any tenting, which is great. That means you're well hydrated. It retracted right back down. So the next thing I'm going to do is I'm going to palpate and listen to your carotid arteries.
Okay, do you want to put my hair up?
Yeah, that'd be great. So I'm going to be listening with my bell. And when I'm doing this, what I'm listening for, I want to know if I hear any bruits, which is just like a whooshing sound if you have like an aneurysm or like a stroke or something. Do you have a history of aneurysms, strokes, high cholesterol. Okay,
Oh, thank
good.
God.
So I'm gonna have you turn your head this way, and I'm gonna have you just hold your breath just for a few seconds.
Your battery's low.
Oh. Okay, sorry. We're
Just
good.
low battery.
All right. All right. So just hold your breath real quick. All right. Don't hear any breathes on that side. Go ahead and turn your head and hold your breath. Good. I didn't know any bruise, so that's great. So then same thing, I'll just have you turn your head. I'm just gonna feel forearm. You don't have to hold your breath this time. There we go, and then other side. All right, so I'm gonna rate those symmetrical at about a 2. They both felt normal. And then we're gonna move on to your face and all of those cranial nerves you got. So we got 12 total. I already did your 11, which is the spinal accessory. So first one I'm gonna do is I'm gonna assess your cranial nerve 1, which is your olfactory. So that just deals with smell and all that. So first I'm just gonna like look up your nose. I'm gonna have you tilt your head back, make a little piggy nose. Take a peek. It looks good. Those mucous membranes are nice and pink, which is exactly what we want to see. Do you get like allergies at all?
I mean, every once in a while, just
Yeah.
like when the winter comes, you know, you just like,
Oh,
stuffy nose.
Yeah. So I'm just feeling the frontal and then the maxillary sinuses. And then next, I'm gonna hold something in front of your nose and you're gonna have your eyes closed.
Okay.
And I'm gonna have you smell and just let me know what it is.
Okay.
Go ahead.
Mint.
It is spearmint gum. Yummy. All right, you can go ahead and open your eyes. The cranial nerve 2 is just your optic nerve. It deals with vision and everything. Do you have any vision issues? Do you wear glasses or contacts?
I wear contacts, but my vision's not like super bad.
Okay. How do those work out for you?
They were great.
Perfect. Next, we're going to go to cranial nerves 3, 4, and 6, which is the oculomotor, trochlear, and your abducens. So it's just like pupil dilation, accommodation, and dilation and movement and whatnot. So I'm just going to have you look straight ahead and I'm just going to take a peek at your pupils. Those are contracting nice. Constricting very nicely. That's exactly what I want to see. Next thing I'm going to do is I'm going to put the pen light here. I'm going to have you look at the pen light and then when I tell you, I'm going to have you look behind me at the wall.
Okay.
And the wall. And the pen light. Good. Okay. So what I wanted to see, I want to see them constrict when you're looking at the pen light, and then dilate when they're looking at the wall. Next thing we're going to do is we're going to move on to the 6 cardinal fields of gaze. So I'm going to have you look at the pen light and just follow it with your eyes only. Don't move your head. Good. Perfect. So I'm going to say that your eyes are pearla. So your pupils are equal, they're round, and they react briskly to light, and they accommodate, which is great. That's what we want to see. Next thing I'm going to do, we're going to test out some cerebellar function again.
Okay.
So I'll put the pen light here.
Okay.
Go ahead and put your finger on your nose, and then touch the pen light, and your nose, pen light, nose, pen light, nose, pen light. Good. Cerebellar function looks good. The next cranial nerve that I'm going to take a look at is your cranial nerve 5, which is your trigeminal nerve. So I'm going to have you close your eyes, and I'm going to touch somewhere on your face, and you're just going to tell me where I'm touching.
Okay.
So I'm going to close your eyes.
Forehead?
Yep.
Left cheek? Right cheek?
Yep.
Chin. Nose.
Yes, ma'am. Perfect. Next, I'm just going to put my hands here, and then go ahead and bite down for me. Good. So vascular muscles are nice and strong. I've already assessed 6, so I'm going to move down to 7, which is your facial nerve. I'm just going to have you make some fun faces at me.
Okay.
So I'll have you smile, and frown, and make an angry face, and then puff out your cheeks. Perfect. Cranial nerve number 8 is your acoustic. It's got your hearing, and it also deals with balance and equilibrium, so we'll get to that a little bit later. So the next one I'm going to assess is cranial nerves 9, 10, and 12. So your glossopharyngeal, your vagus, and your hypoglossal. So I'll first just take a look in your mouth and just make sure, again, those mucous membranes are nice and pink and moist. I do see that you have your tonsils out just like you said. Those look good. Go ahead and lift your tongue up for me. Perfect. And then I've got this nifty little thing. Okay. So I'm just going to put this on your tongue, and then just go ahead and say ah for me. So go ahead and stick your tongue out. So that's your cranial nerve 12. So put it here and say ah. Ah. Good. All right. So the uvula moved up nice. So 9, 10, and 12 are looking good. And then I did note that your soft and hard palate were intact. Okay. So I'm going to have you kind of come over here. And we're just going to do, yeah. Okay. I just want to check your trachea, making sure that it's in line and everything, and it looks good. So then I'm going to come behind you. Okay. And I'm going to put my hands here. I'm going to move it to the side a tad, and then we're just going to have you swallow. Okay, good. Go ahead and swallow. Good. And swallow. Good. Perfect. All right, I don't feel any tenderness at all. Do you have any difficulty swallowing? Mm-mm. Good. Perfect. Okay. So we're going to move on to your respiratory assessment. Yeah, just a tad. Okay. Looks good. All right. Okay. So first thing I'm going to do is I'm going to take a look at your AMP ratio. Okay. I'm going to put my hand right on your breastbone and then middle of your back. And I just want to see a 2-to-1 ratio, which I do, and that's great. I don't want to see a 1-to-1 ratio. That would mean you're barrel chesting, which would not be good. I'm going to untie this if that's all right. Yeah. Perfect. So next thing I'm going to do is I'm going to put my hands down here, and I'm going to have you take a big deep breath. Good. My hands did move, so that's going to be your lung field. Next thing I'm going to do is I'm just going to percuss. Okay. And I want to hear resonance. I'm just going to move the bra here. And again, over here. Perfect. So I did hear resonance all throughout, which is great. And then next, I'm going to listen to those same 6 spots. So I'm going to put the stethoscope on your back. I'm just going to have you take a nice big deep breath for me. If you need any breaks, just let me know. Okay. So go ahead, take a deep breath in. Do that one more time. Yep. Good. Go in. Good. Good. Perfect. Good. Perfect. I'm just going to slide your bra down just a tad. And one more time for me. Okay. And here. Awesome. So I did hear clear lung sounds bilaterally, which is great. It's exactly what I want to hear. While I'm back here, I'm just noting just a couple freckles. Nothing to be concerned about. Spine looks good. I'm not seeing any abnormalities back here. Just some freckles, which is totally normal. I'm just gonna cover you up here. And then I'm gonna have you lay down right on the bed. And I'll have you lay flat first. Okay. So I'm gonna actually. Okay, you're good. Okay. So I'll have you lay. So I'm just gonna move this pillow from you real quick. Okay. And I'll have you turn your head to the wall. So what I'm doing is I'm just looking for any JVD or jugular vein distension. I just want to see if I know any like bulging at all, and if I did, I would raise the head of the bed to 45 degrees and see how long it takes for that to get away. And I'm not seeing any, so I'm going to go ahead and go forward with my cardiac assessment. So you can lift your head up if you'd like to have just a little bit of pillow. Okay. Okay. So then I'm just going to pull this down. Just trying to keep you covered as much as possible. Okay. All right. So I'm going to go right down from the clavicle. I'm going to go down the first intercostal space, right into this second intercostal space here. All right. Right in here. And I'm just listening. Oops, sorry.
No, you're good.
From this side. Listening with my diaphragm first. And this is the aortic valve. That sounds good. Just flipping over to my bell. Coming in right here. And this is the second intercostal space on the right side for the aortic. And I was just listening for any murmurs. I didn't know any. So I'm just gonna flip back over. I'm gonna go over to the left side and just feel for that second intercostal space on the left side. For the pulmonic. It's about right here. Again, listening with my diaphragm. Good. And then flipping over to my bell to listen for murmurs, which I do not hear any.
Sorry, my stomach's making noise.
What's that?
I said, sorry, my stomach's making noise.
Oh, that's okay. A little hungry. All right, I'm going down to the third intercostal space, which is the Erb's point, which is right here. Again, listening with my diaphragm first. Okay, sounds great. Heart rate's going to be a little bit stronger there. And then flipping over to my bell. And no murmurs there either, which is awesome. So the next one is going to be your fourth intercostal space, and that's going to be your tricuspid. So I'm going from the third to the fourth here. Just listening with my bell, or my diaphragm, excuse me. Sounds great. And my flipping over to my bell to listen for murmurs again. And I'm not hearing any, which is awesome. Next one I'm going to, and then this was the fourth intercostal space. Next one I'm going to is the fifth intercostal space, which is your mitral. And I'm just going to go up just a tad to make it easier for me to reach without exposing you. Okay. Thank you. Just gonna go here, find that fourth, and then gonna go down, and it's gonna be about right here. You can actually feel that pulse just a little bit if you're palpating it. So right here, it's gonna be mid-clavicular on the left side. So that's the mitral valve, and I'm just gonna listen with my diaphragm for a full minute to get that apical pulse. Sorry.
No, you're good.
Alrighty. Keeping my finger in that spot. For your apical pulse, I did get a 79. Flipping over to my bell, I'm just going to listen to that same spot here for any murmurs. And I do not hear any murmurs, which is great. So just pull this down for you. So next thing we're going to do is we're going to move on to an abdominal assessment for you.
Okay.
So I'm just going to move your shorts down just a tad.
Okay.
Making sure I'm in the right spots. All right.
Oops.
Perfect. Oh, no,
I
you're
didn't
okay.
mean to hit your arm.
That's okay.
I'm just gonna turn off your little battery.
Oh, yeah, go ahead.
Sorry.
First thing I'm going to do is I'm going to look at her stomach. I just want to know if there's any abnormal lumps or bumps or bulges that I notice. I'm not seeing any, but I do see her aortic pulse right here, right in the middle, which is great. That's what we want to see. So I'm going to go forward with my abdominal assessment. So first I'm going to listen, and I just want to listen for her bowel sounds. So I am starting in the right lower quadrant, going up to the right upper, then the left lower, following the path of digestion. So I'm starting in the right lower. And then the right upper. I want to hear about 5 gurgle sounds in each one. So I heard about 5 over here. And I've got 5 here. And we'll move down to the left lower. Awesome. Got lots going on in there. Next thing I'm going to do is I'm going to listen to all of the arteries. So I'm switching over to my bell, and I'm going to start out with her aortic artery here, and I'm just listening for any bruits. That's again just that like whooshing sound. I don't hear any there. I'm going to go down here to your right renal. And no bruits there. Over to the left renal. All right, and our hip bone is about here, so I'm gonna go down about this area for her left renal, or iliac, sorry. And then over here, I'm just pulling these down, sorry.
You're good.
Over here to her right iliac. And I do not hear any bruits, which is great. So I'm just gonna pull this down just a tad.
Okay.
And then I'm gonna come up here. Is it okay if I come up to your shorts? Okay,
Yep.
perfect. So first thing I want to do is I want to palpate for those femoral arteries. I'm just gonna go right up in here. Nice and strong, or I keep saying renal. I want to say femoral, sorry. Okay. So I'm gonna be right about in this position here. Oh, if you can see that. Right here. It's exactly where I want to be. And then again, listening with my bell for any bruits. And I do not hear any on this side. I'm gonna go over to the right femoral. All right. And again, I'm just gonna go right in there. Just making sure I'm not over the clothing, I'm under. Perfect. I am gonna palpate both of them at the same time, just to note the symmetry of them. And those are gonna be symmetrical. I'm gonna say out of 2. They are a little bit stronger, but I wouldn't say they're a 3 or bounding. Next, I'm going to percuss your stomach or your abdomen. And I want to hear a tympani. Again, I'm going to start in that right lower and go around in the path of digestion. I'm starting right lower. I want to hear tympani. All right, and then the left upper. Nice sounds of tympani. And then the left lower. Awesome. Okay, next I'm gonna percuss up to the border of the liver. And what I wanna hear is tympani, and then when I hit that liver, I wanna hear dull. Right in there, more dull, perfect. Next, I'm going to go in with some light palpation. So when I go in, if you feel any pain or discomfort, just please let me know.
Okay.
I'm going to go in, do some light palpation. Good. I just want to know any like lumps or bumps. I'm not feeling anything. And while I'm doing this, I'm just kind of checking out the skin, making sure I don't see anything abnormal or feel anything abnormal, like lumps or bumps. So next I'm going to do some deep palpation. So this is the part, again, if you feel any pain, discomfort, just let me know and I'll stop. Go a little bit deeper. Good. Are your stomach gurgling? Are you hungry?
I am hungry. It's about dinner time.
All right. I don't feel anything abnormal. Your abdomen is looking great and sounding great. So I'm just going to cover you back up here. And we can go ahead and go through with the legs now. So I'll set the camera back right over here. Ooh. There we go. All right. So I'll come on this side. Okay. First thing I'm going to do is I'm going to have you bend your knees just a tad. And I'm going to feel those popliteal pulses. I'm going to rate those symmetrical at about a 2. I'm going to slip your socks off if that's okay.
Yep.
All right. I'm calling the blanket. There we go. I can see I get goosebumps a little bit. So while I'm down here, I'm noting the temperature of her legs. If there's anything, again, just abnormal, lumps, bumps, moles, lesions. But everything's looking great. I'm not noting any edema or abnormal swelling. The next pulses I'm going to take a look at are your posterior tibialis pulses, which are like right by your ankle here. I'm just going to feel both of those. And those are going to be symmetrical. They're a little bit weaker, so I'm actually going to say they're a 1. But they're symmetrical. It's just a little bit normal for those to be weaker because they are just so far from the heart. Right on the top of the foot, I'm gonna look at your dorsalis pedis pulse, and those are also going to be about a 1. So again, totally normal for those. Also, while I'm down there, I'm just gonna. Your feet are cold.
Yeah, that's normal.
Yeah. Okay. So yeah, they're a little bit colder, but I'm gonna check some calf refill here on both feet. I want to see less than 3 seconds, but since she is a little bit colder, they might be like right at 3 seconds or even a little more. That's totally normal. Everything looks great. I'm going to take a look at some sensory perception for you. I'm just going to poke a spot on you. So this is going to be your sharp.
Okay.
Yep. And then the dull.
Okay.
Got it? All right. So if you close your eyes, poke some spots, and you're going to tell me if it's sharp or dull and where I'm poking.
Okay. Sharp right thigh. Sharp left, like shin. Sharp right top of foot. Dull left thigh.
Okay.
Dull right shin. Dull left top of foot.
And then go ahead and kind of like flex your feet up a little bit for me.
Dull left bottom of the foot. Dull right bottom of the foot.
Perfect. I'm going to give you a perfect score, 8 out of 8, which is great. You have good sensory perception. I will cover you back up. And then what we're going to do, I'm going to have you swing your feet over this way. You can go ahead and sit up for me.
Okay.
If you want to go ahead and put your socks back on, you can. I'll let you do that, and then we'll move the camera a little bit. I want to check your patellar reflexes next.
Okay.
Perfect. So I'm going to put the camera down here. So I'm just going in here. Just going to check those reflexes, right? That's good. Perfect. Love it. All right. I am going to have you slip your shoes on as well before we get started with our next thing, which is, remember how I was talking about that cranial nerve number 8, your acoustic. We're going to take a look at that, and then also some cerebellar function.
Okay.
So shoes are on. Perfect. I'm going to have you stand up. I'm going to be right here for you. And I'll have you stand with your feet shoulder width apart, arms at your side. And I'm going to have you close your eyes. And I'm just watching for any swaying. This is called a Romberg test. So I'm not seeing any swaying, which is great. I'm going to give you a negative Romberg test, which is what we want to see. What we're going to do is we're going to walk normally this way, and then on the way back, we're going to walk heel to toe. And I just want to assess your gait, or like your ability to walk and your stability. So go ahead and go. Good. And heel to toe. Perfect. Awesome. You can go ahead and take a seat. Okay. So that about sums up our assessment on you. The last thing I'm going to do, I'm going to give you a Braden pressure ulcer scale rating. So it's just to see how at risk you are for pressure ulcers. So it looks at your diet, your skin moisture, any like friction or shear, and then like mobility and activity and all that good stuff. So I'm going to give you a perfect score of 23 out of 23. I don't find you to be at risk for pressure ulcers at all. Your skin moisture is great. You're active, you're mobile, and I don't see any like friction, shear, or anything like that. You also have a good diet, which is also very important. And I believe that is it. So do you have any questions for me before I leave? Perfect. All right. Well, thank you.
Thank you.